Good morning, everyone. We are going to try and get started. We're going to give folks just a little bit longer to sign on, so you can just bear with us for another minute or so. Kate, can I ask you, do we have Dr.
Dr. Roberts didn't receive the email from Zoom.
Okay, I can double check and resend. I'll double check his email address.
Sorry, can you say that again, please?
I'll double check his email address and I can resend something.
Okay.
It's D Roberts 1, correct?
Sorry, can you say that again, please?
Is it D Roberts 1?
D Roberts 1, yeah, the number 1 at partners.org.
Okay, I'm going to resend it right now.
Thank you.
Sure.
So as we wait for Dr. Roberts, Kate, we've got David Greenbaum here, our health agent. I think we're also going to be joined by Omar Santiago, the Vice President of Performance Improvement, also a healthcare professional from North Shore Community Health Center. Is Omar on yet, Kate? Let's see him yet either.
I don't see him yet.
Okay. We'll just give folks another minute. Bear with us if we're all waiting to sign up. Kate, any instructions you want to start out with in terms of how things are going to work going forward?
Sure. So we have more attendees now. I just want to share that this meeting is going to be in English and in Spanish. Everyone who comes to the meeting needs to choose their preferred language. So the instruction sheet is right on your screen. So choose English or Spanish. The little button is this kind of globe right here at the bottom of your screen. Choose your language, and then also be sure to check mute original audio, because if you don't do that, you're going to hear both languages at the same time. So that will be a little bit tricky. So please make sure you mute the original audio once you've chosen your preferred language.
And appreciate the work of the team, Kate, you, and members of the Economic Development, Recovery, and Revitalization Task Force, and others. I know Kate Fox and the Chamber have also been involved, Kate Fox from Destination Salem and Arenas from the Chamber, as we're trying to be more inclusive when we think about providing information to individuals.
Yes, I'd like to add to that. Thank you to the North Shore CDC, Nikki and Felicia were fabulous. Elsabelle, thank you for translating. Elsabelle translates all of our newsletters every week. She is phenomenal. So thank you for helping us out with this. And then,
Sorry for the delay, folks. We're just waiting on Dr. Roberts and Omar Santiago from the North Shore Community Health Center. Kate, if you could check in with Omar maybe, just to make sure he's got the right Zoom link, that would be great.
Sure, I'll do that. And then, oh yes, SATV. Thank you for reporting both languages.
So as we're waiting for Dr. Roberts and Omar Santiago, I want to acknowledge Dave Greenbaum, our health agent who's here. Our plan for this morning is to provide a brief COVID update, where we're at in the city of Salem with respect to current vaccination rates, where we're at with respect to our COVID case counts, positive case counts. We've seen a slight uptick, thankfully still hovering in numbers that we feel very good about in terms of the percent positive of our population. Information that we think businesses need to know as we plan for October. That includes what the current requirements are from the Board of Health with respect to indoor masking. We also want to touch base. We're hoping when Dr. Roberts joins us, he can give us a snapshot of what's happening at Salem Hospital, some of the work and advice he might have as we approach a busy October season. I've got to tell you, I was in town this weekend. It feels like every October is growing a little bit closer into September. There were a lot of people in town, many of whom were masking up when indoors. We currently do not need to wear a mask outdoors. We are anticipating, at least during the conversations we've had internally, that if the current conditions remain the way they are, that we're not looking at putting on any additional restrictions. Obviously, the virus will have some impact on that, but based on what we're seeing, it doesn't feel like any of those additional mitigation measures are going to be necessary from right now. We are looking at some of the larger indoor events and how we might be able to work with those operators in using a rapid test method to ensure a little bit higher degree of safety when you're indoors and we know masks are coming off. I see Dr. Roberts has joined us. I know we're working on getting Omar here. And what I think might be useful is to go ahead and kick us off. For folks who don't know me, I'm Mayor Kim Driscoll, fortunate enough to be the mayor in Salem, Massachusetts. This is a community meeting for Salem businesses to discuss COVID-19, how we're preparing for October, and what some of the obligations and opportunities that business and the city can work together to keep everybody safe and healthy. The Economic Development Recovery and Revitalization Task Force has been working closely with the city and with the Board of Health to ensure that we have good protections in place as we head into our busiest season. We thought we would kick off this program by providing a brief COVID update in terms of where we are as a community. And if I could ask Dave Greenbaum to provide us with an update on current case counts, vaccination rates, and the like.
Sure, thank you, Mayor. Good morning, everyone. As far as case rates go, Salem is in a pretty good position, I think. We hold steady on average somewhere between 10 to 15 cases per day, depending upon the amount of testing goes on. That goes up and down, but we average about, I would say, probably 10 to 15 cases a day. As far as vaccination rates go, we are doing very well in our older populations. For instance, 75 years plus, we are right about the state average of 92% at 91%. And from 30 to 74 years, we're approximately 84 to 95% compared to what the state is doing. We do lag significantly behind in our 16 to 29 years, around 46 to 51% compared to the state that's about 70 to 71%. 12 to 15-year-olds are at 63%, which is a little bit behind the state, which is at 69%. So overall, our vaccination rates are very good, but this is for at least one dose. But we do lag significantly behind in that 16 to 29-year age range. So that's where we're trying to catch up with that. In our ethnicity, our white population is beyond the state average of 67%. A multiracial group is about 74%, a little bit behind the state at 92%. Hispanic and Black, they're around 37 to 40%, which does lag behind the state, which is 55 to 57%. And our Asian population is 57% vaccinated, which is behind the state's 71%, fully one dose of vaccinated. As the mayor mentioned, we are not anticipating at this point additional restrictions or mitigation efforts. We will be looking at some of the larger scale balls and activities to see if there isn't a way that we might be able to add that level of safety that she discussed. And the other thing I wanted to mention was testing. We do still have our 2 Stop the Spread sites in Salem. They are both free to all Massachusetts residents. And quite frankly, I think at this point, they're not really stopping anybody from getting a test. So if somebody from out of town did go there or out of state did go there, I think that they would, provide that test. We have the high school site that is there 6 days a week, Monday through Friday from 4 to 8 p.m., Saturday from 10 a.m. to 3 p.m., and our new location for the walk-up site at St. Peter's Church at 24 St. Peter Street. They're there Monday through Thursday, 9 to 3, and Friday, 9 a.m. to 2 p.m. And I'll be here for questions at the end, and Mayor, unless there's something else you'd like me to cover at this point, I can go ahead and do that as well.
Dave, would you just mind covering the current mask mandate, what the requirements are for anybody who might have questions about that? And just for folks who are listening, if you do have questions about anything we're talking about or anything related to COVID that we think we can answer, we'll definitely try to do that. If you could type those into the Q&A space, that's where we're reviewing questions and trying to group things that might come together so we can make sure if you have something on your mind, we're answering. But if you just want to talk about the mandate, Dave, that'd be great.
Yep, the indoor mask mandate applies to all businesses. This includes restaurants, gyms, convenience stores, retail businesses, grocery stores, the Home Depot type stores. So all visitors, employees to those establishments should be wearing a mask unless they have a medical condition that precludes them from doing so. And as with the previous mask mandates, we're not necessarily asking people what that medical condition is. It's very hard for us to request that medical information. But we're hoping to get, pretty high compliance with the mask mandate. We've had some complaints about some businesses. We are following up with those individually, one-on-one, to ensure compliance with the mask mandate as best we can. We are going out, as I said, we will be doing, checking on places. We are enforcing with warnings initially, but if we have, continual violations, that could lead to monetary fines. We're hoping to avoid that. Currently, it is only indoors. I don't anticipate that it will spread to the outdoor areas at this point. And we will be putting signs up in the downtown area in particular, informing visitors to the community of the indoor mask mandate. Those signs should be going up this week.
Thanks, Dave. I know our mask ambassadors are back on the job. A little bit different role because masks are not required outside. So they'll be playing a true ambassador role. They will have masks. We have offered masks to businesses. If you do need masks, we have some that we can provide. And trying to make sure we have a good culture around people knowing what the rules are to hopefully make it a little bit easier on businesses. That they're not the first time hearing it from you that masks are required downtown. I know Dr. Roberts has joined us. I'm wondering if Dr. Roberts is available to provide us with a quick update on things at Salem Hospital. He's off screen. All right, he's back. Terrific. Thanks, Dr. Roberts. Your generosity of your time has helped us, I think, really fight this virus as a community. Grateful for all the partnerships on the vaccine ban and the mobile clinics that we've been able to run. We're in the 60s now. It's not where we want to be with that younger population, but we were in the 50s just a couple of weeks ago. So we're trying to make some inroads there. If you could share with us your thoughts, that would be great.
Sure. I just have a couple of slides on sort of giving people perspective of the world and the nation before we hone down. Is that okay?
Sure. Kate, could you make sure Dr. Roberts can share? I don't know if you can.
I think Bridget's.
Bridget, perfect. She's a co-host. Perfect.
Yeah. Okay. So we'll get through these slides and then we can talk. Next slide, please. So that's what I'm going to talk about. Next slide. So I just wanted to give people an idea that around the world right now, the United States is still not in a very good place in terms of cases per 100,000. You hear about other countries, but right now we have the highest case per 100,000 in the world, which is kind of amazing considering how long we've had access to vaccine. And I love this number below. It's just curious. So Australia has 25 million people and only 1,000 COVID deaths. Florida has 22 million and it has 45,000 deaths. So it just gives you an idea. As you know, Australia went hard on lockdown, and that's the result. Next slide. So this is COVID in the United States. I didn't catch if anyone else has shown this slide before, but you can see that last November through February was a peak, and now here we are at another peak. We're not as high as we were then. And most of that is in other parts of the country, not us. But people ask me, how is this compared to the last peak? It's less, and it's less than the first peak too. And in general, epidemics, pandemics go this way, multiple peaks, and each one is a little bit smaller. The vaccines obviously have a role to play in that, but it doesn't mean we're done with peaks, unfortunately. Next slide. So these are just some of the numbers, just so you can understand it. We're about 100,000 patients in the hospital, about 75,000 in ICUs, and about 1,500 are dying a day. And the daily death totals have more than quintupled since the start of August. But we are, as I showed you, well below the peak of last winter. And for the most part, it's other parts of the country. The overall cases are starting to go down a bit. In places like Florida, maybe just because they've had such a high incidence of positivity. Next slide. So this is the state data over the last 2 weeks. Again, same thing. You see the peak in February. You see our peak now. There's a little turn down in the confirmed cases. Hospitalizations, again, the third peak smaller than the first two, and maybe that's a bit of a plateau. And one of the things that you're going to see here is There's an uptick in cases, uptick in hospitalizations, but there's really not a meaningful uptick in deaths. And the reason for that is some of the admissions for COVID are patients who are vaccinated, and they can get sick, but they don't get sick the way the unvaccinated patients do. And the vaccination rate in the state is pretty good. So the good news is we're not seeing a big uptick in the number of deaths, and that's a good thing. Next slide. So as you've already, I think David went through this before, but the positive rates at Salem and Lynn is the dark blue on this map. So that is a level of concern. And as you know, the positivity, 2 weeks later, the hospitalization, 3 weeks later, the ICU, 4 weeks later, it's the death in the pre-vaccinated era. But I don't think we're going to see that in this era. And the reason why is many of those, as David already said, those positives are in younger people, and younger people are, for the most part, less likely to be hospitalized and intubated. But the positive rates are there. Next. So I want to talk a little bit about Delta for a second. So why are we concerned about Delta? A variant can be bad for two reasons, two completely separate reasons. One is it has devised a way to avoid the immune system, so you get sicker with it. The other is it just reproduces like a rabbit. And so it's one of those two mechanisms. And for Delta, it's mostly its ability to reproduce. And so if you're a carrier of Delta, you can carry at probably 1,000 times at higher viral levels than you did the prior mutation. So you're about twice as likely to give Delta than the prior. It's just the number of viruses that you can carry is just so high. It's likely more severe, but maybe not. And the thing that we did learn is that you can transmit Delta even though you are vaccinated. And the reason for that, you now know, is because it reproduces at 1,000 times the rate of the prior. So here's a really important thing for people on this call to understand. So you're vaccinated, you get COVID. What that means is that you can grow COVID from a nasal swab or from your oral pharynx. And again, that's because if you got exposed to someone with Delta, you're gonna get it in your nasal pharynx. But what the vaccine seems to be able to do is prevent that virus from getting into your lungs and causing pneumonia. So this is a really important point, is we are seeing very little pneumonia due to breakthrough vaccines. We're seeing what I like to call bad flus. And if you're 85 with COPD and heart failure and diabetes, and you get a bad flu, you can get admitted to the hospital. You can be sick, but it's the flu. It's not COVID. So we now know that COVIDs prevent 90% of severe disease, but they're less effective at preventing infection or transmission. So that now you know why. But we know that patients who are vaccinated are 5 times less likely to be infected and 30 times less likely to be hospitalized. And what we are seeing is either asymptomatic, mildly symptomatic, or flu-like symptoms, which can be severe in older people. But for the most part, it prevents you from getting desperately ill. And that's why non-pharmacological interventions like masking, even with vaccinated people, is important, because you can be vaccinated, you can have 1,000 virus in your nasal pharynx, you can cough onto someone, especially an unvaccinated person, and cause them great unharm. Unvaccinated people remain the greatest concern. High vaccination coverage will reduce the spread of the virus and help prevent new variants from emerging. There's another simple scientific fact. If you've got lots of virus and they're reproducing as fast as Delta, and remember, what they're trying to do is to preserve their ability to replicate. That, by the way, that's all any creature does. Their only impetus is to preserve your ability to replicate. And if you can replicate a lot, and you can come up with a variant that makes you a little bit less susceptible to the immune system, that next variant will take off. So the real reason to get everybody vaccinated is decrease the likelihood of a new mutation, which will make our current vaccines ineffective. And then the whole game starts over again. Next slide, please. So you already got this vaccination rate from David. Next. Oh, I'll go back to that last slide. So here's the issue. 80 million Americans are still, who are eligibly vaccinated, have not been vaccinated. So this is a quote from Michael Osterholm. There's lots of kindling. Keep this fire going. And that is the whole story. It is the number of people unvaccinated are going to keep the fire going. Next slide, please. This is from the front page of the New York Times. Saw it here. This is the hospitalization rates in the 10 most vaccinated states versus the 10 least vaccinated states. This is all about vaccination. Next slide, please. So the Salem Hospital, we're still doing pretty well. We've only got 11 patients in the house. We have 2 in intensive care. People ask me what percentage of your hospitalized patients are vaccinated. So here's a simple math problem. If 100% of people in Salem, Lynn, and Peabody are vaccinated, what percentage, and anybody gets admitted to the hospital, what percentage of them are vaccinated? 100%. So right now, 50% of our hospitalized patients are vaccinated, and 50% are not. The vaccinated ones are elderly nursing home patients who are in with flu-like illnesses. The unvaccinated are the 50-year-olds intubated in the ICU, sick as a dog. So they are really different patients. The only other thing I'll mention is right now volume in the hospital is through the roof. I use every instance I can to remind people, do not go to the emergency room unless you have an emergency, because you will wait a long time. Go to your doctors, go to urgent care. It's a hard place right now. Every emergency room in the state is seeing record numbers. We don't quite know why, but that's where we're at. In terms of staff and patient safety, we're at 89%. We are mandating by October 15th. If you we have very few medical reasons and almost no religious reasons. We have about 250 people still unvaccinated. We hope that they get vaccinated because they'll be terminated and their jobs are going to get posted. If you're a nurse, you won't find a place to work unvaccinated. But this is all taking place in the next few weeks. Next slide. Oh, so this is I just want to beat people. Vaccination is the answer, and everything else is mitigation. So masks, sure, they work. They're better than nothing. But in a Delta world where they have so much viral content, it's a challenge. In schools, ventilation. The mayor and I have talked about this a million times. So that's the relative value of the 3 things in my view: vaccination, ventilation, masking. Got to do them all. But if we don't get our vaccination rates up, we're going to have this virus this way for another 3 or 4 years. That's really the answer. So, I think that's the end of my. Oh, one more here. This the booster. People ask me about boosters. So, just a couple quick points on boosters. If you're immunocompromised, it's not good to think of it as a booster. It's really that you require 3 shots when you're immunocompromised. Like with Hep B, it takes 4 shots to get immunized. If you're an immunocompromised patient, you're a 3-shot person. It's not totally clear to me that a booster is necessary. It's not really clear to me that it decreases hospitalizations. A little data in Israel suggests it might. Remember, these vaccines are still very effective at preventing hospitalizations and death. I personally agree with the World Health Organization that says, Africa's got a 3% vaccination rate. I don't think we should boost until the rest of the world gets a shot at a first vaccine. And by the way, I'm saying that not altruistically, but selfishly. The next variant's going to come from Africa because nobody's vaccinated. And then it will get to America in about a day and a half. So I think we should vaccinate the world before we booster ourselves. That's just my, as usual, iconoclastic opinion. And I think that's it, the Mayor, for my comments.
Thank you, Dr. Roberts. Thanks for all you and the team are doing at Salem Hospital. I mean, lots of good data to incentivize getting vaccinated for folks who aren't vaccinated or who have some concerns about it. what could you just, before we go to Omar, you've done this pitch so well. For folks who have concerns, like we are in the 60% in that 60 to 29-year-old range. We've heard some folks talk about fertility issues or it's not proven or tested. You do this commercial so well. What would you say to folks who have hesitancy that this virus could do more harm to them? This vaccination could do more harm to them.
So I've sent out a pitch to anybody that works at Salem Hospital that's reluctant about the vaccine to come talk to me. So I have a stream of people come into my office every day and we have a conversation. The first thing I would say is, if you were nervous to begin with, I get it. There were only 36,000 people in one of the arms of the Moderna study. And you're thinking, 36,000 is not that much. 200 million people gotten the vaccine now. There have been no proven effects on fertility. It's now clearly shown that the risk of getting COVID while you're pregnant is way higher than the risk of having a side effect from COVID. So I think the data, and by the way, lots and lots of pregnant women have now gotten the vaccine, so we've been able to study them. So again, if I was a pregnant woman back when they got released, I'd say, I'm not so sure about this. Now we've got a ton of data. The other data we have is how badly pregnant women do when they get COVID. So I say to that group of people, good for you to wait. You waited the right amount of time, 200 million people, hundreds of thousands of pregnancies. It is safe. And by the way, you're in worse shape if you get sick. So I had a nurse in my office yesterday said, I have a history of blood clot. And I understand one of the vaccines can cause blood clot. So there's a little signal with J&J, but none with Moderna or Pfizer. And blood clots are one of the most common complications of COVID. So this is a classic example where her risk of COVID was sky high because of her predisposition to blood clot. But she misinterpreted the data that she should be more afraid of the vaccine than the illness. And once I could explain that to her, she signed up in my presence to get the shot. There's just a ton of misinformation. The main thing I would say to people, 200 million people, not a single death attributed to the vaccine. It is probably the safest thing we've ever rolled out. And Mayor, the last thing I'll tell you, another argument works with me. I say to patients who take medications, I say, why do you take that medication? I say, well, my doctor told me to. Did your doctor tell you to take the shot? Yeah. So, well, you take your meds, but not the shot. Why is that? And then I say to them, you know how many people were studied before that drug was released on the market? Because I know this stuff. I'd say 1,500 people in the study. And now you take it every day because your doctor said it. There's 200 million people take the vaccine, but you won't take the vaccine. Well, why is that? And they begin to understand that their reasons don't make a lot of sense. But it's really foxhole by foxhole.
Thanks, Dr. Roberts. Again, appreciate all your efforts to help communicate facts to our community and obviously help care for those of us who have found ourselves in a very precarious position with this pandemic. And I want to, last but certainly not least, Omar Santiago, Vice President of Performance Improvement and a healthcare professional himself as a nurse at the North Shore Community Health Center. Omar, thanks for joining us. We'd love to hear a little bit more about the work that North Shore Community Health Center is undertaking and how members of the business community who may not be familiar with the services that are offered, the availability of both vaccines and care at the Community Health Center.
Good morning, everybody. Mayor Driscoll, good morning. Can people hear me okay?
Sure can. Thank you.
All right, great. So I am going to go ahead and share my screen if that's all right. And 1 second to this up. Can people see the slides okay?
That's perfect, Omar.
Okay, great. Well, thank you so much for the opportunity to talk a little bit about, North Shore community health efforts to combat this, this pandemic. And, I just echo the words of Dr. Roberts, just excellent and in explaining, why this is so important and the danger that it poses to all of us. So I wanted to talk about I just have like 8 slides and just want to talk about 3 different themes or related themes. Number 1 is our role, North Shore in vaccinating patients. Number 2, I know that this talk was about mask mandates, so I figure I pull in a couple of slides to why mask mandates are important. And then lastly, I actually had an opportunity to interview our leadership team. So we have some tips into how to make it a little bit easier to enforce the mask mandate. So anyway, so with that, so the first slide here. Right now, what we're doing is that we're vaccinating patients, whether you're scheduled, whether you're walking in, to any of our 3 health centers, in addition to collaborations on the high schools, both in Salem and Peabody. On our side, we offer both Moderna and J&J for all eligible ages. Every now and then, we do get some inventory glitches with the supply from the state or from HRSA. So like there might be like a day, for example, that in Salem, we may not have the shot, but like the next day we have it. So it's just a matter of either swinging by or just calling in, and we figure out a way to make it happen from that standpoint. Let's see. So just a little bit in the numbers. We've done around 16,000 shots. Most of the shots have been to the 01970 zip code, so Salem. So, and the other thing that I like is that the majority of shots have gone to Latino population. So as you can see a little bit on the ethnicity. What I don't like is the rate of vaccinations. Here's just a chart that we have week after week for the month of August through September, and you notice that number going down and down and down. That's a sign that we don't like to see. That the rate of our rate of giving shots has been going down from that standpoint. So anything that we can do, anything that you all can do to encourage your staff, whether it's our patients or not, we'll figure out a way to get them their shot. Okay. We also do a lot of efforts with the community. So here's some examples of the places that we've been to and just offering shots to our to residents. About a month ago, I was down in El Espacio giving shots to patients. We had a band there, and we were able to do that. Had some good fun in doing that. We went to the YMCA, the River House. We've been to a few places, and we're happy to go to continue to visit the other community centers. So, certainly give us a call, send me an email if you're interested. We're happy to come up with a crew and send people over. So that's not a problem. All right, so our approach to vaccination, is a patient-centered team approach. What that means is that we meet the patients where we're at. That's kind of how we're taught, from that standpoint. So we really try to be empathetic and be active listeners to patients. So that means that like Dr. Roberts was saying just before, there is a ton of misinformation that is out there. So we really have to go in there and just make no assumptions and just approach it with an open mind, with just being very active listening, and really try very, very hard to maintain a positive attitude rather than to go into shaming and to going into punitive attitudes. Try really hard to just stay in the positive realm of things. When I have conversations, so I'm a nurse, so Fridays I go and give shots, and I hear it, in terms of patients that come in from that standpoint. So it's something that you have to be very, very patient, for. We like to use motivational interview methods, just a way to just sort of really, really actively listen to the patient and then coming up with goals that are set by the patient, but that we can all agree out in the open of what we want to accomplish. So that's a little bit of our approach into doing that. So shifting gears a little bit into why masks, and Dr. Robert did an excellent expose in the Delta, but I also wanted to show this chart, which when I first saw it, I'm a numbers guy. I pretty much enjoy numbers. And when I first saw this slide, I got a little bit of chills from this. This is from the CDC. It was published by the New York Times. And what you have is that it's just an XY graph where you have on the y-axis, on the vertical axis, the fatality rate of a particular disease. And then on the x-axis, the horizontal axis, is the ability for that disease to spread. So you have things like, for example, the common cold, which is down here, which can spread, but really has a very low fatality rate. You have things all the way up here like Ebola, that have a high fatality rate, but again, cannot spread that easy. The problem is, notice the Delta variant. The Delta variant is now getting into that very dangerous quadrant of something that has a high fatality rate and can also spread faster. And that, when we look at this is what scares us. This is what concerns us as providers, and how policymakers are acting, to say, okay, how can we keep us safe from this? Because this is very, very concerning from that standpoint. Just one more slide on masking. It's like, does masking, social distancing, hand sanitizer, does it work? I felt that this was a very, very good example of that, just visually. What you're seeing here is a map of the United States and the incidence of flu. The picture here on the left is flu of the year before COVID hit. And you have your very, I work in primary care. This is very traditional, for a flu season. You have all these states in red with very high incidence and so forth and so forth. And this was prior to any social distancing or masking due to COVID. So just a very, unfortunately, very normal influenza season, a couple of years ago. Look what happened last year. Well, because we were implementing masking, social distancing, the flu was very, very low incidence from it. And this is probably the strongest evidence, that I could find in terms of the ability, just from a graphical population health perspective into why we do these mask mandates. Why are we encouraging that? Well, because it has the capability of protecting us. And that's kind of where we're leading with that. All right, so some tactics. Again, this is not based on some scientific research, but I did get a chance to interview some folks, and get their perspective into how to help enforce mask mandates. The first one is to have both visible and consistent communication. If we have a poster that says, masks are encouraged, make sure that is consistent across different storefronts, or different establishments. You have the same sort of language sort of indicating that. Making sure, obviously, Salem is such a diverse population, to make sure that that's also in multiple languages from that standpoint. And, on our 3 sites, we certainly try to follow those guidelines there. Have plenty of protective equipment available. As soon as you come into any one of our sites, there's a little station with hand sanitizer. Actually, there's a little box for masks. So it's not that we literally have a person on the door. That's not the case. We actually literally have that station parked right in the front of the door. Like, you actually have to maneuver around it in order to keep going. So that's sort of the tactic that we've gone, and make it just make it accessible for folks, and then make it fun. I was actually in an establishment over the weekend, and they had a picture of a mannequin in shape of a witch with a mask on, right on the front entrance. And that's kind of like, if there's anything that we can do to make it fun, again, keep the conversation positive, is kind of the direction that we should go from that standpoint. So again, along these lines of positive, reinforcement, having staff, for example, when the patient when a client comes in, to say, hey, thanks for doing your part to protect the community. I mean, we actually say that when patients come into our site, absolutely, thank you for doing that. rather than saying things like, no, you can't come in unless you're masked, approach the client with a mask and say, here's your mask, and thanks for doing your part, and the like. And it's really kind of moving away from punitive, from shaming actions, into keeping things as long as possible. And I get it. I'm a nurse. I've been there. So I know that there are cases that is going to go in the direction of the punitive action. But really our practice is to avoid that at all instances, and stay on the positive track as long as possible from that standpoint. So that is pretty much it in terms of, I hope that was helpful for you all, and happy to take any questions.
Thank you so much, Omar. Thanks for everything the Community Health Center is doing. It really does take a team effort as we think about our community versus this pandemic, and we're so grateful to have such strong partners. If you've got a question for any of our speakers, please feel free to type it into the Q&A. It's at the bottom of your screen, right in the middle, and we've got a few in the queue, so we'll certainly answer those. Dave Greenbaum, I'm wondering if you can give folks on the line an outline of what happens if somebody in their workforce does have a COVID positive case. We are really stressing the need to get tested, knowing the transmissibility of this Delta variant, but it's a little different in terms of the protocols that we had in place prior to vaccines with respect to having a staff member come down with COVID. Another reason why getting everybody vaccinated is really critical.
Right. So if you are unvaccinated and you have an exposure or somebody who tests positive in your business, that positive person has to isolate for 10 days. That has not changed throughout the pandemic. Some of the quarantine requirements have changed over the course of the pandemic. It used to be a 14-day quarantine for a close contact. I believe that has changed. It's down to 10 days, and you can test out after 8 days to leave the quarantine early. One of the positives about being fully vaccinated, if you have an employee that has a contact with a positive COVID case, is they don't have to quarantine. As long as they remain asymptomatic and don't test positive during the course of 14 days, then they should not have to take any further action. The CDC does recommend that during that 14 days that contact wear a mask, and they test 3 to 5 days after exposure just to ensure that they are not positive. But beyond that, they really don't have to do anything else. I think to me, that's one of the biggest points about getting vaccinated for, in particular, your employees, is they can go about and live their life as long as they remain negative and don't become symptomatic.
So if you're vaccinated, you may not necessarily have to leave work, even if you've had an exposure. Just to clarify that, am I accurate in that, Dave?
You are, yes.
Okay, terrific. I know that we've had inquiries about if you have staff that are 100% vaccinated or vaccinated and requiring testing, is there a way for us to promote that? I know we've talked about that as a means to let people know who might want to patronize your business, that you are required, everyone's 100% vaccinated who works here. We think that's something that visitors and patrons would be interested in knowing. So anyone who's taken the pledge, it's a similar pledge to the cities, that you are vaccinated and or you're being tested twice per week. If there is something that you're interested in undertaking, we want to try and promote that as best we can to let visitors know that your staff and your business is really doing all that you can to keep everybody safe and healthy. So if you can think about that, those of you who are having employees within your business, that would be helpful. We also had a question about from businesses who are interested in putting in place more of a mandate for entry, a vax mandate. Is that something that the city is considering? Dave, I don't think the Board of Health is looking at that. Can you just say a little bit more about that?
I don't think that the Board of Health is looking at putting in a vaccine mandate for businesses or beyond the mask mandate. I think that at this point, if businesses want to do that, we can certainly work with them to, provide resources to do that and assist them in ways to bring that program to light. But it doesn't appear at this point that the Board of Health is going to be issuing any mandates around, vaccine passports.
And so one of the ways that we could help a business, if a business wanted to undertake that, because we have heard from a handful of folks, would be signage, assistance with perhaps vax verifiers, we would call them. These would be people who could help you, whether it be at the door or offsetting some of the costs that you might have with respect to making sure folks know what the rules are. And again, promoting it for businesses that want to call that out as another means of keeping people as safe as possible. We have had a question about testing, testing opportunities. I think you went over that prior, Dave, but if you just once again share with folks 6 days a week and the need for testing, if you are experiencing symptoms, why that's important.
Yep, so we do have testing 6 days a week here in Salem. We have the drive-up site at the high school, which is open Monday through Friday, 4 to 8, and Saturday, 10 a.m. to 3 p.m. The walk-up site downtown at St. Peter's Church at 24 St. Peter Street is open 5 days a week, Monday through Friday. It's Monday through Thursday, 9 to 3, and Fridays, 9 to 2. And the importance of testing is, it's very important that we know who is testing positive in our community so that we can isolate them and work to stop the spread of the virus. We, not knowing if you have it and you're having symptoms, getting tested and finding out one way or the other is very important just in that respect to, help limit and stop the spread of the virus.
Thanks, Dave. We do have a question in the chat around what should a business do with regard to enforcement if guests are not complying after they've been either admitted to the establishment. Dave, do you want to take that to start off?
Sure. It's very difficult. We're not encouraging people to get into, confrontations with people who don't want to comply. If they are looking for some sort of an accommodation, then I would recommend doing curbside delivery or having them pick up outside the store, things like that. If it gets volatile and people are not complying and they're just becoming belligerent, my best advice is to call the police and let them come out and try and de-escalate the situation.
Again, we are trying to have mask ambassadors, a little different role since there isn't a requirement outside, to hopefully create a culture with signage and making sure folks know what the rules are. So the first interaction that you have with them is not going to be the first time they're hearing this message. I know that Destination Salem is making sure information is available online, visitor guides, and that it's quite clear to anybody who's visiting what the rules are here. Kate, do you want to say, I know you're on, I'm not sure if you're planning on offering any commentary, but I'm wondering if you could just say a little bit more about the work underway to inform visitors ahead of time what the rules are in Salem.
Sure, thank you, Mayor. Good morning, everybody. We have updated our advertising and marketing strategy for the fall to clearly and concisely communicate the mask requirements in Salem. We are doing retargeting digital advertising that retargets anybody who's visited hauntedhappenings.org and serves them with several ads with the mask information. And we're also actively promoting the new app. We did update the app for 2021, and we will be using that for push notifications and COVID safety. We've also launched the new Salem.org, and on that we do have the capacity to put health guidelines on every business listing that's on the site. And we can certainly add to that fully vaccinated or taken the pledge to be either fully vaccinated or frequently tested. And we will work with the city on the appropriate wording there. So we're doing everything we can to clearly communicate the guidelines. All the press releases we're doing around fall travel to Salem include the guidelines for the indoor masking and just, taking care to protect yourself and others when you visit Salem this fall.
Hey, Mayor.
Yes, Dave.
I don't mean to be the voice of doom, but once we go inside when it gets cold, given how easily Delta gets spread, our numbers are going to go up. There's no question about it. And I think I would just be so grateful for any business that would take the vaccine pledge. It would be just great if and I personally would go into stores that said all our folks here are vaccinated. I think that's a draw. But I think the pressure on vaccination is going to go up because this is going to spread once we all get inside. And if you're inside for more than 15 minutes in a 10 by 10 room with someone who is carrying COVID, in your mask, your chance of getting it is high, especially if the ventilation in the room is poor. So the more we can get people to understand that vaccination is the way out of this, the better off we.
Thanks, Dr. Roberts. Really good points. Again, we stand ready to work with any business who wants to put in place a vaccine requirement. We have heard from a handful of businesses, particularly in October, when everyone's cup runneth over, so to speak, that they really feel like having people coming from around the world makes it a little bit safer environment if everybody's vaccinated. If that's something you're interested in, please reach out to myself, mayor@salem.com. We'll be working with the chamber, with Main Streets, with Destination Salem. If there are businesses who are interested in putting in place a vaccine mandate, we want to help do that. Again, signage, personnel, to the extent that we can help with personnel or offsetting the cost of your person to be the vax verifier, we would really be, we have an ability to help do that, and I think we'd welcome it. With respect to where to get vaccinated, we did have a couple queries around that. You can get vaccinated just about anywhere these days. If you go to salem.com/COVID, it has the list of all the places. We know we have mobile clinics that we're running. So if you have enough staff, let's say you have a nucleus of people who wanted to get vaccinated, if you could let us know, I'm sure we may be able to coordinate with you to make it as easy as possible for staff. We've got a question about restrictions on lines, and that was certainly something we were paying attention to last year. David Greenbaum, do you want to talk to a little bit about that? I don't think we're anticipating undertaking anything different than we're currently operating.
Yeah, I don't think that we anticipate putting in any restrictions on lines at this point. Again, with the virus, this is all something that is subject to change, but we understand how difficult it was last year. We're trying to, be as least impactful as we can, based upon the data that we have at the time. If that data changes in the next week or two, then things could change. But I think at this point in time, there is no plan to put a restriction on lines.
And I think the big difference is obviously this year we have more people vaccinated. Last year there was no vaccine, and bunching up in those lines in close proximity, even with a mask, was deemed something that was risky behavior. This year, what we're being told is outdoor activity is very low risk. That's the reason we don't have the mask mandate in place. If in fact something were to change dramatically, my sense, Dave, and please weigh in here, is that we'd go back to that ladder, right? We had occupancy restrictions, we had masks outdoors, we did a lot of things that built back up to, additional restrictions. I don't think it would certainly turn from what we're doing now to the harshest. Is that fair, Dave Greenbaum?
That is fair, and I think the board is very cognizant of the difficulties that were in place last year and what it took to work through that. And I think that they are very, very cognizant of the impacts it had on business. So they are trying to do the things, as the mayor said, in a stepping stone process to go from least impactful to most impactful. And the hope is that we never get to those restrictions that were the most impactful.
So we've got a question in the chat about whether we'll have any pop-up vaccine clinics. There was one during Arts Fest. I think we'll definitely try and schedule those, keeping in mind that you're not, immune from the day you get the vaccine. It does take some time to build up any sort of immunity from the virus.
Yeah, on the topic of vaccinations, I want to point out that the state vaccination program, it does have a mobile van that's going around, and businesses can request that to come to their business. If businesses are interested in that, please reach out to us. We can get you the details on how to request that. Like the mayor said, if you have a core of people that want to get vaccinated, the state will certainly send their van out and do that type of a vaccination effort for you.
And Dave, just how somebody could contact you?
They can reach out at health@salem.com, or our phone number is 978-741-1800.
Any other questions before we wrap up? We've been on just about an hour. I want to make sure we're responsive to what might be on your minds as we head into a very busy month. I know we have another session scheduled to try and coordinate more of our public safety requirements. Please know that we are gearing up for what we think will be a large crowd here in October. We're already seeing, as I said, in early September. That entails a tremendous amount of coordination and planning, both from traffic and parking and public safety. This particular webinar is tied to public health and some of the expectations we have going forward in that arena. So if you've got questions in that area, please let us know. And I really want to thank the Economic Development Recovery and Revitalization Task Force, which includes city staff, Tom Daniel and Kate Newhall-Smith, and members of Destination Salem, the Chamber of Commerce and Main Street. So we're all really coming together to try and make sure you have information to both support your businesses, but also keep everyone safe and healthy.
Yeah, just one other thing, if I can, before we sign off. If people do need masks or signage, we have been handing those masks and signage out to businesses that have requested them. Please reach out the same way at health@salem.com. We can work to get you some masks and signage for your businesses so that the signage is consistent across all businesses, as Omar pointed out.
Great. I don't see a lot of other questions. There's a question about if the vaccination van is fully staffed. I know they're working, they've had some struggles at times if it's an odd time to get people there, but the van is available for anybody who wants to use it. We've got a question around hospital protocols with respect to how we're handling this. I think that's probably an offline question I can forward to Dr. Roberts and have him get back to you. Anything else? Not seeing any other questions. I will once again just thank everybody for joining on. Our goal this October is to keep everybody safe and healthy, as we say, strong and open and safe. And as we move forward, we want to be here as a partner. None of this is easy for the people who live here, for the people who run businesses here. And we definitely want to work with you to answer questions and keep moving Salem forward in a direction that works for you and works for our community. Kate, either Kate Newhall-Smith or Kate Fox, anything else as we wrap up?
No, I just wanted to say thank you to the panelists. The presentations were wonderful. The slides were sobering but very informative. So thank you. I appreciate that, David. Thank you for the lowdown on what we're doing here in Salem. So thank you for your time.
Okay, thanks everybody. Stay safe. We'll see you at our next webinar coming up later this month. Thank you.